91 patients that are addicted to opiates will die in America today, and we are trying to reverse that.
We will do anything in our powers here to make sure that you're getting the help you need. From the second you walk through the door, you're never judged by a single person here, not one.
Advancement in Recovery is a full-service outpatient opioid treatment program. We offer medication-assisted treatment. Anybody with opioid use disorder or alcohol use disorder can come in and access treatment.
This program is unique in that it helps them address the whole issue. So it's not just taking a pill or it's not just using heroin. It's the whole lifestyle that's involved in the use of opioids and heroin. We treat individuals individually based on their individual needs, and we look at the whole picture. So we look at the spiritual, the physical, the emotional component of why they're struggling with this in order to help them recover.
Addiction is a brain disorder. It is treatable, and it takes many different ways to treat it. One aspect is medical, so you absolutely need medication. One aspect is counseling, and we have both services here to help. Every patient, when they first come in, they get an intake from our program manager or another counselor, and that intake determines their severity of addiction and also determines the level of care that is recommended.
Their first meeting with me would be, their intake within a room, a clinic room. I do a full physical exam from head to toe. I do an extensive history regarding their medical history, what type of medications they might be on from another provider, who they see for their primary care. And then we talk about treatment options.
Daily medication-assisted treatment is when patients come in every day to get observed dosing of medication. We do that with both methadone and with buprenorphine naloxone.
Well, the patient is given an order from the physician, and they are given a particular medication for their appropriate diagnosis. I will meet with them, ask them how they are, assess them for any kind of sedation or any other worrisome symptoms, and I will dispense their medication. As a nurse, I like watching the progress that I see others make just by making the first step to recovery.
There's really two different kinds of counseling offered in our program. So there's individual counseling, and that's where a patient meets with a counselor one-on-one. It's really important to understand that the use of the drug is really just a symptom of a larger issue at hand, or many large issues. And so through individual counseling, we can start to identify those significant problems and really address those. Group therapy is a little bit different than that, and that group therapy really helps to decrease kind of the isolation that an individual who's had substance use disorders for years really is familiar with. So we want them to reduce isolation, start to connect with another human being, learn that other people are in their shoes, they're not alone, and also start to hear other people and how they're recovering, and that it is possible, and that their life is changing. Success for our patients mean that they are going to the emergency room less, they have less involvement with the criminal justice system, they're able to obtain employment and housing, they don't have to steal or cheat or lie to be able to get drugs. They're just able to become the person that they used to be or that they want to be.
If you tell somebody that you have opioid use disorder, for me it's like telling somebody that you have chest pain. This could be life-threatening. You could die very soon, and it's urgent. It's an emergency, so it's important to access treatment right away. Treatment works. To get them to a point where they can be productive members of society again is huge.
If you truly want to change your life and you want to make sure that you can successfully thrive in the future, I feel that it's best to take the first step somewhere like here, because we genuinely care. We want to see you do well.
I have to give our patients a lot of credit, because this is not an easy, it's not an easy road, and it's a daily struggle, but it is possible.
I thank these patients for coming and allowing me to help them, because there's so much more than their addiction, and I just want them to know that.
Some people just want to be mom or dad or grandma and grandpa or, get a new job or start a new life or have a family. So to be able to help them realize their dreams is so fulfilling.